It's absolutely right that we cannot expect the NHS simply to rely on the goodwill of staff going above and beyond the call of duty to meet the needs of patients. That's why the government is committed to publishing a new workforce plan to create the workforce that's ready to deliver the transformed service set out in our 10-year health plan. We're already working with health unions, both on issues around pay, which people would expect, but also the conditions that people are working in, recognising, as my honourable friend rightly does, that this is not just about doctors, important though they are, it's about the entire NHS workforce who are delivering the improvements with this government that the country is so desperately crying out for. In fact, under our predecessors, not only was this allowed to emerge as an issue in the NHS, it was normalised, with even benign nomenclature like temporary escalation spaces being used to endorse this normalisation, which should never have been considered normal or acceptable. We'll be shortly setting out our plans for publishing data so that we can be held to account as well as the system. I am clear I want corridor care gone over the course of this Parliament, and I'm confident that when we publish all of the data surrounding this winter, it will have been better than last winter. But I also want to be honest with the House and the country, Mr. Speaker. Even on the best days of this winter, there are still patients being treated in corridors and in conditions that I do not believe are acceptable and we should never allow to be normalised, which is why we're committed to year-on-year improvement.
Question number 2, Mr. Speaker.
So stay.
Thank you, Mr. Speaker. Rural and coastal constituencies like South Dorset are at the heart of our shift in the 10-year plan from hostel to community. Not only does everyone deserve care closer to where they live and work, but people in rural and coastal areas often see the sharp end of health inequalities. After 15 years of damage, this government is determined to change the current postcode lottery of where you live determining the care you received. So as announced in the budget, we're committed to delivering 250 neighbourhood health services across every part of England. There are also now 100 community diagnostic centres across the country offering out-of-hours services 12 hours a day, 7 days a week. Lots done, but lots more to do.
Lloyd Hutton.
As the House knows, I'm deeply concerned by the state of maternity care we inherited in the NHS. While a majority of births go well, I know from the courage of families who have spoken up and the concern of staff that there are devastating impacts arising from failures in care. That's why I asked Baroness Amos to chair an independent investigation into maternity and neonatal services to drive urgent action. But that's not stopped us from taking action. In the meantime, we've invested over £131 million to improve neonatal care facilities, brought in a new maternity care bundle, implemented a programme to reduce the 2 leading causes of avoidable brain injury during labour, and increase maternal mental health services. But there is so much more to do to guarantee safety now and into the future, and also to ensure truth, justice and accountability for past failures.
Paul Wall.
Thank you, Mr. Speaker. The new maternal care bundle, which the Secretary of State refers to, is rightly aimed at reversing the recent worrying rise in maternal death and ill health, particularly with an increase in obstetric hemorrhage, which concerns so many midwives, doctors and, of course, the families affected themselves. Given the government wants to help women to make informed choices about how they give birth safely, can the NHS do more to highlight the well-documented risks of severe bleeding and placenta accreta that's caused by caesarean sections?
I'm grateful to my honourable friend for his question. Everyone accessing maternity care should be offered a personalised care and support plan informed by a personalised risk assessment. This is so women have more control over their own care based on what matters to them, their individual needs and preferences, and also to make sure that every woman understands the risk factors that might arise in her case. A caesarean section is generally a very safe procedure, but like any type of surgery, it does carry a risk of complications. All women should have the confidence of knowing that the doctors and midwives dealing with them are robustly trained to deal with severe complications, including hemorrhage. And that's why the maternity care bundle, as well as other measures, is leading towards greater safety, more information, and crucially, personalisation of care and patient choice for the mother.
Laura Coates.